Chapter 11, Treatment of Sleep Disorders and Attention Deficit Hyperactivity Disorder. We'll skip over the key terms because we will go through them in the chapter. Sleep is a necessary biological function for the growth and maintenance of a healthy body. It's needed for a healthy immune system and nervous system. Our physical and mental agility, memory, emotional, and social functioning are also improved when we get sufficient sleep. The body's sleep cycle is influenced by circadian rhythms. Circadian rhythms are biological changes that occur according to time cycles. The pineal gland controls the release of melatonin, a hormone that makes people feel drowsy, in addition to regulating body temperature and hormone secretion. The fact that our normal sleep-wake cycle is linked to sunlight explains why people who work the night shift may feel uncontrollably drowsy in the middle of the night. And it explains why workplace accidents occur more frequently in the middle of the night than during the day. The normal sleep pattern involves 5 stages. In stage 1, the person sleeps lightly and can be awakened easily. Sudden muscle contractions of the limbs may occur, similar to when a person is startled while awake, and the eyes move slowly back and forth. In stage 2, sleep eye movements stop and brain activity decreases. Stage 3 and 4 sleep are very deep sleep. The brain activity slows. It is difficult to wake someone from stage 3 or stage 4 sleep. If awakened, the person feels disoriented. The final stage of sleep is known as rapid eye movement sleep because of the characteristic eye movements that occur. This is the sleep cycle where dreaming occurs, and it lasts between 90 minutes and 110 minutes. REM sleep is crucial to normal emotional and physical functioning. Approximately 2 hours per night is spent in REM sleep. The thalamus and cerebral cortex actively communicate with each other during REM sleep. And the cortex is the region of the brain involved in learning and interpretation of information. Nearly 1 in 3 adults in the United States and Canada report that they get insufficient sleep. Insomnia is a sleep disorder that affects nearly 60 million Americans each year and up to 1/3 of the world's population. Patients may have difficulty initiating sleep, maintaining sleep, poor sleep quality, and or a duration of sleep that is short. Chronic insomnia lasts longer than 3 months for at least 3 nights per week, and it can be associated with another medical condition such as pain or a psychiatric condition. As many as 12% of the people who say they have insomnia complain about periodic leg movements. Restless leg syndrome is reported in up to 12 million Americans and is more common in elderly adults. Diabetes, pregnancy, and anemia can also cause restless leg syndrome. Sleep apnea is a sleep disorder that affects up to 25 million people in the United States. It is a condition associated with an interruption in the supply of oxygen during sleep, which causes the person to awaken. Sleep apnea can increase the risk for cardiovascular disorders such as hypertension, myocardial infarction, and stroke. People with sleep apnea also have an increased risk of arrhythmias, heart failure, diabetes, and obesity. Rarely, sleep apnea is fatal. Sudden death occurs from respiratory arrest during sleep. Narcolepsy is the least common of the sleep disorders. It affects approximately 1 in 2,000 people. It is characterized by falling asleep suddenly and without warning. Attacks can last between a few minutes and 30 minutes. In most cases, the cause is unknown. However, some patients with narcolepsy have low levels of the brain chemical that controls wakefulness and arousal. Pharmacological treatments for insomnia are recommended only for short-term use. Drugs that are used to treat insomnia are benzodiazepines, benzodiazepine receptor agonists, and melatonin. It is important to know that drugs that promote sleep do not result in a normal pattern of sleep. meaning taking these medications to help sleep is not going to make it better to where you wouldn't need these anymore. They alter non-REM and REM sleep. This can result in rebound hypersomnia and increased dreaming once the drugs are discontinued. Guidelines recommend prescribing the lowest effective dose and close monitoring of sedative hypnotics and sleep, because most of the prescription drugs used to treat insomnia are habit forming, like benzodiazepines. So sedative hypnotics are drugs that induce relaxation and drowsiness. Benzodiazepines like temazepam and benzodiazepine receptor agonists like zolpidem and zolpidem are prescribed for the short-term treatment of insomnia. Zolpidem is a biphasic controlled release formulation. Food reduces absorption, so zolpidem should be taken on an empty stomach. Nearly all of the benzodiazepine and benzodiazepine receptor agonists are controlled substance and can produce tolerance and dependence. Sedation and dizziness are other side effects that are common to all of these medication. Driving, preparing food, and engaging in other activities while asleep with no regulation of behaviors have been reported with zolpidem, which is Ambien. So we have a table that lists benzodiazepines and benzodiazepine receptor agonists that are used in the treatment of insomnia. So back in chapter 5, we talked about benzodiazepines and how they're used in the treatment for anxiety. They are also used in the treatment for insomnia. And as you can see, this list of benzodiazepines, if we went to the anxiety chapter in this book, it wouldn't list these same medications. Even though they're all in the same class, these ones are more geared towards being prescribed to someone that needs sleep versus anxiety. So somebody that has anxiety and needs sleep, perfect medication for them. So temazepam is really popular. Flurazepam is pretty popular. Triazolam, I didn't see prescribed a lot for insomnia. We have benzodiazepine receptor agonists like Lunesta, which is azopiclone and Sonata, zolpidem, which is our Ambien, Ambien CR, and there's now a couple newer ones, Edular, Intermezzo, and Zolpamist. And you can see those come in a variety of dosage formulations. Melatonin is a hormone that regulates the circadian rhythm sleep-awake cycle. And we have the miscellaneous drugs used in the treatment of insomnia. So doxapen and Rosarim. Melatonin is a hormone that is produced by the pineal gland. It is sensitive to light changes and tells the body it is time to sleep. Doses of 3 milligram to 5 milligram have been used for treatment of short-term insomnia and enhancement of sleep. The greatest evidence for efficiency of melatonin is in the prevention of jet lag. The use of valerian root dates back more than 2,000 years. Galen recommended it for the treatment of insomnia. A dose of 600 milligram aqueous extract taken 1 hour before bedtime has been shown to be effective. Diphenhydramine and doxylamine are other OTC drugs that are used for short-term relief of insomnia. Diphenhydramine and doxylamine should be avoided in men who have benign prostatic hypertrophy because they can cause urinary retention. The antihistamines may also reduce the milk supply of breastfeeding women. So we have over-the-counter medications and herbal substances used in the treatment of insomnia. So diphenhydramine, which is just over-the-counter Benadryl, but there is quite a few now that are being marketed just for sleep. So like Simply Sleep, Unisom sleep gels, Nitol quick caps, and there's even more than that now. There's like ZQuil now, tons of different ones. Doxylamine is usually found in Unisom, and sometimes you can find some herbal supplements that have melatonin with doxylamine in them. Melatonin, you can find that over the counter in the vitamin aisle. It's usually pretty cheap. It's recommended quite a bit for sleep, first line therapy. So, of course, we're not going to just be like, oh, you have anxiety or you have insomnia. Let's give you Ambien. We're going to try to give you something or recommend something over the counter first. So, of course, there's non-pharmacological treatments for insomnia. You can avoid stimulants close to bedtime, adopt a regular sleeping schedule, avoid daytime naps, create a safe, comfortable sleeping environment, do not go to bed hungry, exercise 20 to 30 minutes each day, avoid ambient lighting produced by electronic devices such as cell phones, tablets, laptops, and television. Do not lie in bed awake. If you do not fall asleep, get up and engage in a non-stimulating activity such as reading. Then try going back to sleep again in about 10 minutes. This chart here lists the summary of drugs used in the treatment of insomnia. So we have our warning labels, may cause drowsiness. So that is a given. Any sleep medication is, of course, going to cause drowsiness. And of course, if you take sleep medication, you should not get in your car and drive at any point after taking it. I don't care if it's only been a few minutes. You should avoid alcohol. Alcohol with these medications can produce the side effect of respiratory depression. It can be habit forming, and it should be taken about 30 minutes before bedtime. We have our miscellaneous. If you look at some of the warnings over here, avoid taking after eating a high fat meal. And that is for the Rosarum. That's definitely a typo there in the book. Avoid alcohol for all of these. These also are habit forming. The primary treatment for narcolepsy is the administration of stimulants. Stimulants used in the treatment of narcolepsy include amphetamine, methylphenidate, modafinil, armodafinil, and modafinil and armodafinil are non-amphetamine stimulants. The drug's mechanism of action are not fully known, but it is believed they stimulate alpha adrenergic receptor sites. And modafinil and armodafinil are also prescribed in the treatment of sleep apnea. And modafinil should be taken in the morning to avoid insomnia. Both of these medications are controlled substances as well. So ADHD is the most commonly diagnosed childhood behavioral disorder in the United States. More than 10% of school-age children have ADHD. Symptoms are also commonly observed in children without ADHD, making diagnosing this pretty challenging. These symptoms are hyperactivity, restlessness, an inability to sit still when required, impulsiveness, inattention, distractibility, forgetfulness, and an inability to complete tasks. All children sometimes exhibit these behaviors. A diagnosis of ADHD should only be made when these behaviors occur more frequently than would be expected for the child's age, and if the behavior interferes with two or more areas of the child's life. These areas are defined as school, playground, home, community, and social relationships. So put a check mark next to each one of these that sounds like your child. A variety of drug treatments are available for treating patients with ADHD. However, medications cannot cure ADHD. They only can control these symptoms. The most effective therapy for ADHD involves drug treatment in addition to behavioral therapy. Pharmaceutical treatments of ADHD is achieved with the administration of amphetamines and non-amphetamine stimulants. Amphetamines behave differently in people who have ADHD than they do in people without ADHD. They decrease hyperactivity and improve focus rather than produce hyperactivity and a lack of focused behavior. Amphetamines are sympathomimetics, structurally similar to norepinephrine. They work via three primary mechanisms. They stimulate the release of norepinephrine, block monoamine oxidase, and stimulate the release of dopamine. Amphetamines are well absorbed from the GI tract, and their lipid solubility enables them to cross the blood-brain barrier. They are metabolized in the liver and eliminated in the urine. Lisdexamfetamine is a prodrug that is metabolized to dextroamphetamine. Amphetamines are manufactured in immediate release, sustained release, and extended release dosage forms. The duration of action varies according to the dosage form administered. Tamoxifen is a non-amphetamine stimulant. It inhibits the reuptake of norepinephrine. Stimulants should be taken in the morning to avoid insomnia. The most common side effects of amphetamines are decreased appetite, nausea, stomachache, anxiety, and irritability. They can also cause insomnia. Insomnia can be minimized if the last dose is taken before 6 p.m. Amphetamines have a high abuse potential. They are Schedule II controlled substances in the United States. And here we have drugs used in the treatment of attention deficit disorder. Amphetamine and dextroamphetamine, dexmethylphenidate, lisdexamfetamine, methylphenidate, which is Ritalin, and now has been reformulated into all of these different extended release tablets. And then a tamoxifen is Strattera, and that's the non-stimulant medication used for ADHD, and it comes in a variety of strengths. Now we have the summary of drugs used in the treatment of attention deficit hyperactivity disorder. This chart lists the usual child dosage, and most of these are C2 narcotics. So if you look at the immediate release versus the extended release, you can see a lot of the immediate release, they're taking 1 to 2 doses a day. For a child, it's much easier to give them one capsule or tablet in the morning and know it's going to work the entire day. So that is why these extended release have been formulated. And it's kind of nice because they're not called out of class, 2 to 3 times a day to take their medication, which takes away from their learning and also creates, even though it shouldn't, it does create somewhat of a stigma, especially the older the child gets, when people notice, why is that person leaving the room all the time? So really nice for that instance right there. There is a patch, Daytrana, that is worn for 9 hours per day. So that's another thing that they made to kind of offset the number of trips in doses that the patient would have to take in the office, the school office.